Good afternoon. It's the little things, like morning or afternoon, that we have to. I think most of the people know the people here today. From my far right, Linda Lacewell, Superintendent of the New York Department of Financial Services, and also on the Emergency Management Task Force that is handling this. The good Dr. Zucker, Melissa DeRosa, Secretary of the Governor, Beth Garvey, who is the special counsel to me. Let's give you an update on COVID-19. These are the new numbers. Westchester County is up 10. New York City is up 17. Nassau 2 and Rockland 2. As we've said, keep in mind what we're doing here. These test cases are not representing a random sample. They are not statistically accurate to the growth of the spread of the disease, because this is a selective sampling. We are primarily sampling people who are associated with people who test positive, right? People look at these numbers as almost a statistical representative sample of what's happening. That's not what this is. These are positive cases tested primarily from a universe of people connected with someone who tested positive. What they do show is a continuing problem in Westchester County. And it's not Westchester County, it's New Rochelle. New Rochelle at this point is probably the largest cluster in the United States of these cases. And it is a significant issue for us that we'll speak about in a moment. You can see even New Rochelle compared to New York City. That 108 in Westchester, you may as well say New Rochelle. So New Rochelle's at 108, New York City is at 36. I mean, that is really breathtaking. Again, putting things in focus, Washington State is at 179, New York at 173. You see how much higher the deaths are in Washington? That makes the point that we've been talking about, who will be most likely affected by this situation. And Washington State, it was in a senior citizen home. And that's what this is all about. That's what this is all about. What does it mean? What does it mean? What is the bottom line? Senior citizens, people who are in the vulnerable population, senior citizens, underlying illness, compromised immune system, that's who we're trying to protect here. And you see that in the 22 deaths in Washington compared to New York with no deaths, right? Same number of cases, look how much higher Washington is, because it's about the senior citizens. And our focus governmentally, nursing homes, senior citizen congregate living, our focus on an individual level, senior citizens, compromised immune systems. Again, what is the net effect of the disease? People talk about it like it's the Ebola virus, which was really a serious and frightening virus. We have 173 cases, only 14 people are in the hospital. Well, how can that be? Because people are at home recovering from flu-like symptoms. 14 out of 173. If you look at the 14, most of the 14 are members of that vulnerable community. Again, you want to put this all in perspective? The single best way to put it in perspective is the Johns Hopkins tally, which has tallied all of the cases since China. 114,000 cases. That's China, that's South Korea, that's Italy, that's the United States. 4,000 deaths, again in the vulnerable population. 64,000 people recovered. 46,000 cases still pending, people getting treatment or people at home. That's the entirety of the universe. New Rochelle is a particular problem. It is what they call a cluster. The numbers have been going up. The numbers continue to go up. The numbers are going up unabated. And we do need a special public health strategy for New Rochelle. What we are going to do is focus on an area, concentric circle, around the situs of the majority of the cases in New Rochelle. Much of the transmission tends to happen on a geographic basis. Kids go to school, kids go to a store, parents go to a store, parents walk down the block, shake hands with someone, parent is walking the dog, meets somebody, says hello, has a conversation. Remember how this spreads. It can spread from it's a respiratory illness, droplets of a sneeze, a cough, it's on somebody's hand, you shake hands, now you have an issue. So containment strategies focus on geographic areas. Commissioner Zucker has been working on this. This is the single greatest public health challenge we have in the state right now. And coming up with a special strategy to deal with this has been his focus. He has recommended a plan to me. I have accepted the plan, which will deal with this containment area, and the Commission will speak to it in a moment. One of the things we're doing is we're putting a satellite testing facility from Northwell into New Rochelle. So they will set up a facility within that containment area that can do testing. Northwell received approval last night for their automated testing capacity, which increases Northwell's capacity to test. We had been waiting for the CDC to do that. The CDC approved that. Northwell will open up a temporary satellite facility so they can do testing right in that area. Even testing is a problem, right? Somebody gets in a cab to go to the hospital. Now you possibly affect the cab driver. Somebody gets on a bus. Now the person is on a bus. So this is a major advantage. We're also going to use the National Guard in the containment area to deliver food to homes, to help with the cleaning of public spaces. There is a debate about how long the virus can live on hard surfaces, and you have differing opinions now. Some opinions are the virus can live on a hard surface such as stainless steel or plastic for 2 days or more. If that's the case, that would be a significant issue as to why it is transmitting the way it does. So cleaning those surfaces is very important, cleaning it with the right material, and the National Guard will be helpful on that. With that, let me turn it over to Dr. Zucker to talk about the strategy for New Rochelle.
Thank you, Governor. So as we know, this is an evolving situation, and we're addressing many different points as we move forward on this. We have spoken before about the issues of containment, and we have moved from a containment strategy to more of a mitigation strategy. When you're dealing with mitigation, you have to deal with the issues of some social distancing and how people gather together and to try to minimize that. And one of the places where people gather together, particularly, is the school systems and schools and other areas, events and daily or weekly activities. And we believe that the most important thing from a public health standpoint is to minimize that. We know where the sort of the center of the activity has occurred from the information, the public health, and the epidemiology investigation from the beginning of the Westchester and Rochelle outbreak, and we felt that a mile of a radius of a mile from that spot would be effective in an effort to try to decrease the spread. I spoke to some of the public health experts the other day and also this morning, all the time I should say, about this issue, and we have to remember that we are sitting with the first point on a curve, or first couple points on a curve, and it would be wonderful to be able to go in the future and look back and see how this curve is going to evolve, but we don't know that. And so the most important thing to do is to take all the precautions we can and balance that from a level of protection with that of what could be somewhat disruptive, and we understand some things will be disruptive. So we're moving forward with that and happy afterwards to discuss it further.
Okay, I want to thank Dr. Zucker for that. The doctor's plan is March, the period would be from?
March 12th, starting this Thursday.
March 12th from this Thursday, a 2-week period where facilities within that area, schools within that area would be closed for 2 weeks. We'll go in, we'll clean the schools, and assess the situation. This will be a period of disruption for the local community. I understand that. Local shop owners don't like the disruption. Nobody does. Local politicians don't like the disruption. I get it. This can't be a political decision. This is a public health decision. It's not a decision that I'm making. I'm accepting the recommendation of Dr. Zucker. In a situation like this, whether you're president, the mayor, the governor, let the experts decide and let the science drive the decision. When you politically interfere in science, that's when you tend to make a mistake. So again, the period is March 12th through the 25th. 1 mile is a fairly constrained area. It is a dramatic action, but it is the largest cluster in the country. And this is literally a matter of life and death. That's not a overly rhetorical statement. A couple of other facts. I've asked the controller of New York, Tom DiNapoli, to give me an opinion as to what consequences he might think this economic shutdown and the entire coronavirus situation will have on the state budget. As you know, we're ready to do the state budget. The state budget anticipates this year's revenues and projects next year's revenues. You have what's going on in the stock market. You also have what's going on the economy overall, right? Conventions are being stopped, tourism is down, hotel bookings are down, restaurants are down. So we just did the budget projection estimates. The world then changed since then, so I asked him for any advice that he might have. As I mentioned earlier, there are different opinions on how long the virus can live on hard surfaces. So much of this is new and evolving. No one really knows for sure, so you tend to get different opinions. And the doctor is talking to people all day long. I'm talking to people all day long. There is an emerging school of thought that says the virus can live longer on hard surfaces than originally anticipated. Could live 2 days, maybe even a little bit more. I'm asking all the public transportation authorities in the state to redouble their cleaning efforts. It's easy enough to clean. It's a question of bleach or another cleaner that's approved by the EPA that kills viruses. But if it is 2 days on a hard surface, a bus, et cetera, just pictures people are walking around, that is a different situation, and I want to make sure that the cleaning protocols are up to date. Again, as a point of clarity, the state put out a regulation yesterday. Any school that has a child that tests positive must close immediately for 24 hours. That 24-hour period is only a period to allow assessment of the situation, to determine what the remedial course is, right? So it's not, it must close for a day, and then it's going to open the next day. It must close, then you do an assessment, then you determine what to do with the school. And that will be done on a school-by-school basis because the facts change. And I think that's it. One other point of clarification. You cannot joke. Do not joke. Whenever you joke, you get in trouble. Hand sanitizer that we presented yesterday, the state is not making a profit from the sale of hand sanitizer. The hand sanitizer is not for sale. It is given to other jurisdictions, state use, prison use, bus use. Certain people have commented that it's a for-profit and tawdry, that the state is profiting from the sale. We are not selling the product. Questions?
New Rochelle, just want to talk a little bit about New Rochelle. You know, Scarsdale School, they had somebody test positive. Another local school had somebody test positive. So why, how far do you make that quarantine, and why, you know, specifically New Rochelle? Obviously, you know, that's where it emanated, but how broad do you make this quarantine?
So we looked at the area from the hotspot, if you want to call it that, and decided to go out 1 mile and as a radius into the area, see what the encatchment area of that, those schools that are in that area and other gathering sites that are in that area. We do recognize that there are other areas outside of that specific 1 mile that may be schools that have closed already. But this is an evolving process at this point.
So when you talk about the quarantine dates, right, it's like I mean, that could be a rolling kind of situation, right? I mean, if you find somebody tomorrow, then it's 14 days for that person. That's 14 days for the guy, the
What we're
person
saying
tomorrow.
about closing, you're mixing things between quarantine and closing. What we're saying is that we're going to close those schools, obviously clean the school, obviously try to break the spread of this disease. And if you look at it from a public health standpoint, you're trying to break one person infecting the next person, and they just keep going, and you go to the spot where the hot spot is, and that's what we're doing.
Is that the only thing that's going to happen in the
But
containment
Joe,
area?
excuse me a second. But Joe, you're fundamentally right. Look, you have people who say it shouldn't be 1 mile. It should be 2 miles, it should be 3 miles. Look at, you have the Scarsdale schools, they're outside of that circle. You should make the circle much larger. You have other people, I call them the deniers. This is not a big deal, it's all going to be fine, you don't have to do anything, don't close anything, don't disrupt anything. So you have opinions all across the board. That's why I say, go with the science. Go with the science. The political mechanism can't make these decisions. So Dr. Zucker, who is extraordinary in this field, let me just take a moment to say, I talk to people at the World Health Organization, NIH, Dr. Fauci, who's one of the international best. They all say to me, you have the best with Howard Zucker. They all say it. He's been in Washington, everybody knows him. And I'll tell you the truth, it's given me such comfort because he is nationally reputed as really an expert in this area. So we talk to everyone, but then someone has to make a decision. In this case, Dr. Zucker makes the decision. And he has a balanced approach. And I think the 1 mile circumference demonstrates that.
In that 1 mile circumference, I mean, is just the schools are going to close? Are you going to order businesses closed? What
We're
is
going
that
to go
gonna do?
through what's in that circumference. You have schools. I don't know if we have any. It's major gathering places. So we have to look at it. I don't know if there are public buildings. I don't know if there are large social gatherings.
Everything within that mile shut down?
No, not everything, just large facilities that do large gatherings.
And we're, sorry, excuse me, and we're working directly with the mayor and the county executive to identify a list that we all agree on, but as the governor said, it's focused on the major congregate areas, not all businesses.
So people can go back and forth to their homes and businesses will remain open, or?
Yeah, it's large congregate facilities or gatherings.
Travel restrictions of any time?
No, you can go in and out, it's just those facilities that would bring large numbers of people together can't do it for a period of 2 weeks.
Was that like grocery stores?
No.
or Pharmacies?
I mean, people can walk down the street.
Large gathering facilities, schools, temple, what else?
There's a Boys and Girls Club that was on the list they asked us to consider, so things like that.
The point in the middle of that 1 mile.
We'll get you the exact list after this, but it's the school, it's not the entire New Rochelle School District, it's the schools within that 1 mile radius.
Yeah, it is no school system. It's a geographic concept. So it's whatever school, public, private, is in that 1 mile area.
Is allowed to quarantine within that?
No.
No, so you're just saying, okay.
We're
Joe.
trying to break the spread, and people gather together, sorry.
Large public facilities that bring large quantities of people together.
So where's the point that you're starting from again?
We're looking where it began, and so that's why we sort of say this is where there were the most individuals who were infected, and so that's where we started from, and then we marched that out to a mile radius in that area.
And how is this being enforced? Would people be fined if they violate this?
Well, it's not really people, it's facilities. I don't think anyone is going to violate it. You know, you're talking about a school, primarily schools, any large congregate gathering place that would be operating in the next 2 weeks. I don't know if they're planning any concerts, any conventions, or whatever.
So does that include like the upper schools of the New Rochelle public system? Because if that's the case, or if it's not the case, then a kid from the containment zone is going to the high school out of the containment zone.
Yeah, Jimmy, there's no, you're not containing people, it's facilities. Somebody who lives in that containment area could be in this room today. There's nothing you can do about that.
But what schools within the New Rochelle district are effective?
We can get you the list of the actual schools, but yeah, the high school, yes.
I believe. High school's like, out of, so is the high school gonna be one?
The ones that are in, I'm sorry.
There's a list of schools, we'll give it to you right after this, that fall within that 1 mile radius. And then the other schools that we're talking to is SAR Academy, the Westchester Day School, the Westchester Torah Academy, so the other schools that have already been impacted by this because the population is in that base center.
Scarsdale closed down, they're
On their own.
outside of the area,
Yeah.
they closed down on their own.
You can't say what the pinpoint is. You know, you've got a 1 mile circle. What's the pinpoint?
It's the center of the cluster.
Right, an address, a building.
Oh, I don't know, but it's whatever's in the middle of that 1 mile.
Part of the city is this, east side, west side?
I don't know, look at the map.
Is it only within New Rochelle?
I'm sorry?
It's only within New Rochelle?
Yeah,
Aside from Rick Cotton, have any other state officials or members of their staff tested positive?
no.
Governor, is that, can you say if this could be used to be replicated in other parts of the state, as we see a lot more of these tests possible?
Well, this is unique in the United States of America. We haven't seen this anywhere else. Just think about it. New Rochelle has more than double the number of cases of New York City. It is true, it's a phenomenon.
So is there a thought that you could use this as a way to contain it in other parts of the state as we start to see?
Well, that's
more?
basically what you're doing across the country, right? We close schools, right? That's what everyone's doing, is closing schools. What does it mean when you close a school? You're closing the large gathering area in that community. That's what you're doing. You're closing colleges. Why? Because that's the large gathering place. So this is just a different manifestation of that. We're closing the large gathering places, schools, in a geographic area around this cluster because this is not your normal pattern, right? It's not a shotgun pattern of disparate cases. This is a true geographic cluster.
Well, this is clearly more, a greater step than what you've done, but so I'm wondering if you do, are you looking at this as a possibility of being used elsewhere or even statewide at some
We
point?
don't have any, I haven't heard of anything else like this anywhere.
Governor, do you have any information on, more about Rick Cotton and how he actually contracted coronavirus?
No. He is doing well. Did you speak with him today?
Last night, he's doing well.
You spoke with him last night? I spoke
He's
with him
asymptomatic, he's home,
well.
he's doing fine.
We just seen a report that it wasn't at an airport, that it was a separate person he came into contact with on Friday.
I don't know.
This is goes back to the issue of community spread and what we've been speaking about. And so perhaps he interacted with somebody who was positive.
On the issue of nursing homes, is the state going to be doing any sort of spot checks or auditing of nursing homes to make sure they're compliant and cleaning or have required sort of things in place to make sure that it doesn't spread?
We regulate them normally, and we inspect them normally. Our actions to date have been more on giving different guidance on how they should operate. I don't believe we've been expanding the inspection protocols.
Has been working on a vaccine. Are there other local companies that have been also working on a vaccine?
Can you start that again?
Regeneron is working on a vaccine right now. Are there other local companies in the state working on a vaccine as well?
I don't know. Maybe Dr. Zucker knows. Regeneron is a great company. They've done a lot of groundbreaking work. We do a lot of them with the state. The Regeneron started with an economic development grant in this state given by a person named Mario Cuomo, who at the time, the way their economic development program worked, they would give a company a grant and they would take a part of the company, a stock interest in the company. So New York State invested in Regeneron, had a number of shares of stock. The stock exploded, went crazy. New York State sold the stock somewhere along the way, made a lot of money. Not as much money as if they had kept the stock, because the stock has continued to go up. So Regeneron was born from New York, and now it's just a multinational company. But I know they're working on it. I know other companies are working on it also. You have to develop the vaccine, and then you have to go through the testing protocol. So most people will say that it's about 1 year before you get through all of that. That's when the president says, I think we're weeks from finding a vaccine. You can find a vaccine within weeks, if you're very optimistic, but then you have to test it. So it probably comes out to a year, but I don't know what other companies are doing that.
Governor, coming up this weekend, there are some St. Patrick's Day parades, I think in New York City, Buffalo, Rochester, Albany, I think has one too. Should they reconsider holding these parades?
You know, Nick, you have to look at the specifics here. You look at the map of the state. You have very few cases in some area, and you have larger numbers in other areas, and then you have critical numbers like New Rochelle. So you have to calibrate it to the place. You know, this is such a different situation in different parts of the state.
Healthcare workers that work with
Let's take one more.
Assist with childcare. I mean, we have thousands now of families in New Rochelle. These kids may be out of school. Is the state prepared to help with any of these parents?
Yeah, we're going to work with the local officials, and whatever we need to do to help, we will.
Governor, can you explain how Washington, the nursing home seems to be the epicenter of the death, certainly, in Washington State, but not in New York State? You still don't have a case, right? Right. But how have you been able to do that? What have you learned from that, and what have you learned from Washington?
Go ahead.
Well, a couple things. Many of those deaths were in nursing homes, and so we have worked very closely with our long-term care facilities to address that. Yesterday, we mentioned that no visitors to certain nursing homes, and we're also pushing back on the number of people who can visit and being very aggressive on making sure that anyone who's sick is identified.
Should all healthcare workers be tested if they work with patients directly?
help with food delivery